Hello guys, welcome back to my channel. Today we'll be discussing how to break bad news during your OET speaking. And if you are visiting my channel for the first time, I would advise you to hit this subscribe button. But before we go into this in detail, let's first of all look at how the general tips that we can use for OET speaking. Okay, so we look at the general tips that we can use, and these the first tip here is what we call GRIPS. This is like an acronym. So when we say GRIPS, we are referring to greeting, rapport, introduce yourself to the patient, identify your patient, and I try to identify the setting of the role play. Okay, so you should make your grips to be very sharp and smart in this case. So in greeting your patient, you can say hello, you can say good morning, good afternoon, good evening, depending on the time of the speaking test. Okay, but if the setting is you are in accident and emergency, I don't think it would be right for you to say good morning, good afternoon, good evening, because there is really nothing good about someone being in accident and emergency. In that case, you can just say hello. Okay, now you also try to create a rapport with these patients by trying to like say something like welcome to the clinic, welcome to the general practice, welcome to the hospital. Okay, you then introduce yourself. You can say hello, I'm Dr. Thompson, one of the doctors in this clinic. I'm Dr. Thompson, one of the junior doctors in this clinic. Okay, now you also try to identify your patient. You can ask the patient, please, what may I call you? Okay, or you can identify the patient by just trying to ask, are you Mr. Joseph? The patient will say, yes, I'm Mr. Joseph. Okay, that's another good way to identify your patient. You can also identify your patient from the beginning, assuming that the name of the patient is already written in the case note. You can just tell the patient, hello, Mr. Smith. Mr. Smith will say hello. You can then say, I'm Dr. Thompson, one of the junior doctors in this. So it's another good way to identify yourself. Okay. Now the setting, just as I've said, I'm Dr. Thompson, one of the junior doctors in this clinic, in this hospital. Okay. In this accident and emergency. Okay. So you are trying to identify the setting of the role play Okay, this is very, very important that you do. So you should make your grips to be as sharp and smart as possible. Okay, now also try as much as possible to be natural when you are speaking with your patient. Use your normal tone. Don't try to fake your accents, trying to imitate the breathing. Don't try to speak very fast because you are trying to rush the whole task. Besides, there is no special mark awarded to those that finish the bullet points. So you just have 9 criteria. If you meet those 9 criteria, they will score you. They will score you on that. Also, allow your patients to talk. In the academy, I've seen some students, they would just talk without allowing their patients to talk. When you talk for like 10 to 20 seconds, you probe your patient. Oh, Mr. Smith, I can see that you're in pain. I'm sorry you are going through this, but we are going to help you through this, okay? Mr. Smart will say, okay. Okay, Mr. Smart, do you have any other concerns? Do you have things bothering you that you would like us to address? These are like some of the questions that you can use to probe your patient so that your patient will talk. After finishing like a bullet, sometimes you have up to like 4 or 5 tasks in your role play. So maybe after finishing the first task, you can ask, are we on the same page on this? Okay, let me be sure you got me right. Can you just explain to me how I described you have to take these medications? Mr. Smith will describe. Then after describing, I say, okay, Mr. Smith, do you have any question that you want me to address? Mr. Smith will say yes or no. So that's how to lead your patient to talk. So don't just talk from one point, from one task, you jump to another task, from one task, you jump to another task. That will look like giving a lecture or a tutorial, and that's not how the role play card should go. Now, also lead your patient. I've already said this. Always lead your patient. You initiate the discussion, you sustain the discussion, and if time allows you, you end the discussion. Not that you will finish one bullet and pause and be waiting for the patient to talk. You are the one in charge here. So you should use the leading question to lead your patient to talk. So anytime you finish a point, try to lead your patient. Are there things you still want to tell me? Are there things still bothering you? Is there another thing you want us to discuss? Mr. James, are there things that are not clear for you that you want me to clarify? Okay, so these are how you lead your patient to talk. Now, another thing that you also do is to watch out for empathy. Watch out for empathy cues. Sometimes the patient will say, Doctor, I'm really angry right now. You want to leave my patient to die. You want to leave my mother to die. You can tell the patient, you can tell the interlocutor, I can see that you are angry. I'm so sorry that you feel this way. Okay, so these are way to you watch out for empathy cue and use the right empathy cue to address it. If the patient is in pain, you can tell the patient, I can't imagine how discomforting this must have been for you. I can't imagine what you might be going through right now. Okay, so try as much as possible to empathize with the patient. Whenever you have an empathy cue, don't try to miss it. Now, don't worry if you did not finish the point in the task, because if you are rushing to finish the point in the task, your speaking will not be natural, and in that case, you will not allow your patient to talk, and in that case, you might even forget to lead the patient. So, you might even miss some empathy cues that the patient might be giving to you. So, don't worry if you do not finish the point in the task. There is no mark allotted for candidates that finish the task. Some candidate might finish the task and they will score less than 350, and some candidates might not finish the task and they will score over 400. So the assessment is based on those 9 criteria. If you're not still conversant with those criteria, you can go to some of my speaking tutorial that I release on this channel. You will understand them better. Okay, so now let's go to the steps that will follow while breaking bad news. Now, whenever you have a bad news, okay, let me bring this. Oh, sorry. Let me bring this down. So, whenever you have a bad news, what are you going to do? You will maybe the task, the first point in your task says, tell the patient that the mother has stroke. You know, for somebody to have a stroke, this is a bad news. You're not just going because the task says tell the patient that tell the patient relative that the mother has stroke. You will not go straight and now tell the patient relative, your mother has been admitted and he has stroke. That will be shocking to the relative. That will make the relative to be uncomfortable. So while breaking bad news, there are steps that you need to follow. Okay, all those points that you see in your card, they are to guide you. That does not mean that you have to follow them judiciously. So there are some points, the steps that you need to follow. Let's take, for instance, you want to break a bad news to a patient that was diagnosed to have a HIV. You have to follow this step. You want to break a news to a patient that was diagnosed to have intracerebral hemorrhage. You have to also follow this step. So find out how the patient is doing first. A patient just came to you, and not just going to start after greeting the patient and tell the patient, oh, you have a stroke, because the first point in your task says you have a stroke. That will be shocking to the patient. Your relationship building in that aspect will not be good, and incorporating the patient's perspective there will not also be clear. So you have to find out first, how are you doing, Mr. Smith? Mr. Smith will say, I'm fine. Are you having any symptoms? Okay, Mr. Smith will tell you. Then after that, you can, if it is the patient relative, you can actually also try to find out what the patient knows about his condition, or what the patient relative knows about the patient condition. You can say, oh, Mr. Smith, what do you know exactly about what you are managing your mother for? The patient relative can talk to you. If you are talking to the patient directly, you can tell the patient, you can ask the patient, do you have any idea what this condition might be? Do you get? Then it will allow the patient to talk, and by so doing, it makes your discussion natural. Then you already have the results of what you want to discuss, but in this case, you are trying to prepare this patient to receive your news. Then the next thing that you can also do is to try to offer support. You can ask the patient, maybe the patient has this, you diagnose that the patient has, let's say, something like an intracerebral hemorrhage, and you want to talk to the relative. You can ask the relative, do you have anyone here with you that can support you at this moment? You're already giving the patient a warning shot that you are about to release something bad to the patient. So this is like warning shot you are giving this patient. Okay, then you offer support. Do you have any person with you here, okay, that can support you at this moment? The patient might say yes or no. If the patient says no, you now say okay. Then in breaking the bad news, you break this news in two layers. You don't just go and now tell the patient, okay, from your result you have cancer. Okay, you can tell the patient, you can say something like this: Mr. Smith, I'm afraid I don't have a good news for you. You've given the patient first warning shot. You broke the news in first layer. Then the second layer will now be, I'm so sorry that your results confirms that you have cancer. Okay, so even your tone and the way you release the news, your relationship building there will be really very optimal. Okay, then after breaking the news, the next thing that you have to do is to pause. Okay, then you pause and allow the patient to talk. When the patient talks, then you pick up from there and continue with the task. So this is how you break bad news. You don't just go straight and release the result. So we are going to play a we are going to play a recording now. Is a typical exam template. Okay, how to break a bad news. Okay, let's listen to it now. Hello, Mr. Brown.
Hello, doctor.
I'm Dr. Thompson, one of the doctors in this suburban clinic. You were here some couple of weeks ago. Can you still remember me?
Definitely, doctor. I remember you, Dr. Thompson.
Oh, that's nice.
Yes.
Well, Mr. Brown, you are here today. What brings you to the hospital?
Well, doctor, last time I came, I had
Okay,
some tests done. So
okay.
I came today to find out about the test results.
All right. Let me quickly go through your notes. Oh, okay. You are right, Mr. Brown. You came last time, you complained of a groin swelling. Am I correct?
Definitely.
Okay. How is the groin swelling now?
Well, much better, I believe.
Okay. All right, Mr. Brown, your test results are actually ready, but before we discuss the results, I would want to ask you some questions. Is that okay with you?
That's very okay, doctor.
All right. Mr. Brown, do you have any other complaint that you want us to know?
Well, doctor, I actually had a fever and sore throat.
Okay.
Yeah, but I feel these symptoms are resolved because I feel quite okay.
Okay, that's good to hear, Mr. Brown. Um, if I may ask, do you have multiple sexual partners?
Yes, doctor, I do have multiple sexual partners.
Okay, when last did you have sex?
This would be around the last time I came. That was about 2 weeks ago.
Okay. Do you practice safe sex?
You mean use of condoms, I believe?
Yes, Mr. Brown.
Well, Dr. Thompson, I don't always use condoms, to be honest. There are several occasions that I can remember having sexual intercourse without condoms.
Okay. Well, Mr. Brown, your results are ready. The last time you came, we did a full blood examination, liver function test during microscopy, and these results all came out to be normal.
Oh, great. I'm glad to hear that, doctor.
All right. We also screened you for HIV the last time you came.
Yes, doctor, I'm aware of that. How
Oh,
is the result?
okay. Unfortunately, I don't have a good news for you. The results came out to be positive. I'm so sorry, Mr. Brown.
Wow, this is really unfortunate, doctor. But doctor, are you sure about this? Isn't there another test that you would or could do to confirm this diagnosis?
I can understand this might be difficult for you to believe, but we had a repeat test and it also came out to be positive for HIV. I'm so sorry the result came out this way. I wished the results were negative.
So, Dr. Thompson, this means I have HIV for sure. Does that mean I'm going to die? I'm really scared and worried right now.
Well, the good news is this, Mr. Brown. We have um, a lot of treatment options now, and these medications are readily available that you can take, and you they can make you to live comfortably and live as long as any other person out there. Is that okay with you, Mr. Brown?
Okay, Dr. Thompson, this sounds really good. I'm really comforted by this.
Yeah. I don't know. Do you still have any other concerns or things you might want us to discuss?
Well, doctor, um, I think I'm kind of okay with all the explanations you've given me for now.
Okay. But Mr. Brown, you told me earlier that you have multiple sexual partners. It would be nice if we could also screen them. We would want you to get in touch with them if possible and let them come for us to screen them. How does that sound?
Wow, doctor, this doesn't really sound like a good idea to me. Are you sure this is a good idea? I would like my information to remain as confidential as possible.
Oh, okay. I see. Um, we can also contact them anonymously without disclosing your identity, but we want you to provide us with their contacts and their anything that can help us to reach them. Okay?
Okay, Dr. Thompson, that
Okay.
sounds much better.
Okay. That's nice. Well, Mr. Brown, I don't know. Do you have any other thing you want us to discuss?
No, doctor. Thank you very much. You've been
It's
very
okay.
helpful.
Thank you very much, Mr. Brown. We'll see you in the next clinic.
Thank you.
Bye.
Bye.